Thank you, Chairman. When Democrats passed the Inflation Reduction Act in 2022, they talked about lowering Medicare costs. Now we need to ask who actually benefits from the IRA provisions. Specifically, do seniors benefit? Premiums for Medicare prescription drug plans are up 50% in the first 2 years since the IRA passed. Plan choices are down 25%. Millions of seniors will face higher copays on drugs selected for government price controls. The IRA was sold as making drugs affordable, but seniors are left footing the bill. Ms. Axelson, the so-called negotiated prices for the first 10 drugs were recently released. Can you explain what impact will likely see in out-of-pocket costs and access for Medicare beneficiaries who happen to be on any of these 10 drugs?
Thank you. So for the drugs, for 7 out of the 10 drugs, their dominant position on formulary is already third tier or better with a $45 to $46 copay. The seniors who are in the drugs with preferred position on formulary will not see an effect. Millions of other seniors are already receiving a low-income subsidy. They will not see an effect. For the seniors who are taking, or disabled people who are taking a specialty drug, they have a $2,000 out-of-pocket cap, whether or not that drug has a price control or doesn't. So they will all pay $2,000. They will not see an effect of the price controls. Some of that savings is accrued to the federal government. Some of that savings is disappearing because premiums are going up. Also remember, those drugs that were selected for price controls do not pay into the Medicare drug discount program. That was not taken off the $6 billion in estimated savings, so that's another cost that's going away. So for people who are satisfied with the government setting prices, I guess that's a benefit, but a lot of the benefit is not accruing to the seniors from these price controls, and there are better ways to come up with the money for the out-of-pocket cap.
So, Ms. Axelson, thank you very much. So who actually benefits? Who benefits, cui bono, from the drug price setting provisions?
There are some savings to the federal government, and I think there's some satisfaction that's gained by those who feel the government should be setting prices. This is not a negotiation. A negotiation is a business arrangement where you can walk away. You cannot walk away from this negotiation without having a financially ruinous penalty. That's not how they do it in other countries, if that is a system that we feel we admire, where there's more restricted access to medicine.
So you walked us through some of the near-term implications of this. What do you think will be the long-term impacts on seniors' access to these 10 drugs and any future drugs that make this price-setting list?
To these 10 drugs, there is a potential, because this erodes the value of launching a generic or biosimilar, that seniors will not see the tremendous long-term benefit of generic and biosimilar entry. Big markets attract big generic competition and multiple generic competitors, and that brings prices down. That's why price controls deter that kind of activity that is a long-term benefit for seniors. The drugs that are already developed, but it's the future drugs and it's the future indications for existing drugs that are most affected by this law.
Thank you, Ms. Axelson. Ms. Axelson, I know there is bipartisan concern on this committee, bipartisan concern about drug shortages. It's good that there's work underway to address harmful contracting practices that focus singularly on price. In many cases, manufacturers are ceasing to produce certain very low-cost drugs because reimbursement is too low to remain financially viable. Now, under the Inflation Reduction Act, passed with all Democrat support, manufacturers who seek to increase prices on these drugs so that they can continue to produce them will be charged a penalty for those increases. This will only exacerbate the downward spiral and lack of availability. Ms. Axelson, should special consideration be provided to drugs in shortage and exempt them from price inflation penalties and include other categories of medicines prone to shortages like generic sterile injectables to ensure that they continue to be produced?
The price controls will create shortages. And I recently published a paper that shows that in Medicaid, even when other suppliers are entering the market, even if you were to enter at a lower price relative to other suppliers, you can't increase your price in the instance of a shortage or manufacturing costs going up without having that penalty. So the system is set up both because the price controls dissuade generic entry, but then also in the case of a shortage or if manufacturing costs go up, the system would still penalize people for those price increases.
Thank you. Chairman?
thank my colleague. This has been a hectic morning in the Senate, and just a fact for Democrats and Republicans as we continue